So welcome. I'm Dr. Sara Siddiqui. I'm a pediatrician at the NYU Langone and Huntington Medical Group, and I'm here back with the fabulous Elwood Public Library for our monthly pediatrician, lecture series. And this month we're going to talk about the teen vaping epidemic, which I was just talking to Eric, our librarian, that we don't hear much about it recently because there's so many other things that are that we're kind of thinking about and focus on, but it's still, it's still something that we need to talk about. We need to talk about to our children. So this specific lecture, what I'm going to be going through is particularly vaping in children. So I understand that there's a lot of adults that, instead of smoking are vaping, and it may be something we still don't know the exact, ramifications of that, but there are a lot of studies going on regarding smoking versus vaping in the adult population. But specifically what we're going to concentrate on today is children and vaping, and unfortunately children pick up vaping as a first exposure to tobacco or nicotine, and even children are vaping other substances like THC, which is the active component of marijuana, and that's what I wanted to talk about. So we want to really target the children's or teen vaping epidemic. So let's just get started. Again, I practice in Huntington, and I'm not representing any other entity. I'm speaking as a pediatrician from NYU Langone Health. And let's get started. And please, as Eric said, if you have any questions, we can answer them as we go. And just put them in the chat box. If there's something that you asked and we're done and you're watching like a re-recorded, or you're watching it later, you can reach out to me and I'll be happily able to answer, or I'll try to answer any questions that you may have. So why are we worried, and why did this become like such a huge issue? So why are we worried? And basically we started seeing reports as early as 2012 and 13 that children had picked up this habit, or children were starting to use something called ecigs, e-cigarettes, electronic cigarettes, or vaping. And when it really started, we really started hearing a lot about it was in 2017, 18. And then we started seeing reports from the Tobacco Youth Survey. So what we saw as recently as 2019, the Tobacco Youth Survey reports that 1 in 4 high school students have tried e-cig or vaping in the last 30 days. That's significant. The past year alone, vaping among high schoolers had increased almost 80%. And this is after we started kind of doing we started campaigning against e-cigs in children, or trying to target education and cessation in children, trying to prevent children from starting it. But that's when we saw like the deepest rise. So we got very concerned. At that time, the Surgeon General also reported e-cig use among youth was at epidemic proportions, and they actually came out and said that. So this was prior to the pandemic. They had called the vaping an epidemic among our youth. So that's why the alarm started going off at that time. So just to kind of go over the definition, essentially it originated out of from typically how it became into being was electronic nicotine delivery systems and trying to replace cigarettes. So it was a way for actually smokers to try to quit smoking and vape, and it was thought of as like a safer way to, I guess, imbibe nicotine. And it does deliver nicotine flavorings and other additives through inhaled aerosol, and we're going to get to that a little bit later as to why it causes such an issue in the lungs, especially in children's lungs and in their brains. And they have a variety of names, as you can see, but vape pens are probably the most common name that we see now. And these are the pictures from the CDC, essentially showing the early usages and the early ways that they were marketing them. Basically, it was more to mimic cigarettes, but now it does not look like that. And there's many different types. They vary in price, quality, and design. So, and you can purchase them pretty much anywhere, even currently, even after all the regulations have been in place now for about a year. We try to pass Tobacco 21, and which essentially is the prevention of any cigarettes or e-cigs, e-cig products sold to under the age of under that age range should be difficult, but unfortunately it is still very easy for children to obtain. And you could get them on the internet, although that's not the way that the children are getting it currently. And the newer models resemble USB devices. They can resemble a pen or a flash drive. So vaping is the process of inhaling an aerosol. So it can be nicotine or cannabis, or again, the active component of marijuana called THC. And smoking is when you conventionally the combustible cigarette, where you're actually burning the product and inhaling it into your lungs. So because you're inhaling an aerosol, it was kind of marketed as the safer option. And that may be the reason why a lot of adults are vaping, because you're not having that combustible or burned aspect of smoking. And so you're not inhaling all the chemicals that you inhale when you smoke, but vaping has its own subset of products that you're inhaling into your lungs, which is separate. So this is a slide about how a lot of people think that they're just inhaling water vapor, or that it's like it's just similar to inhaling as if you're in a sauna or a steam room, just like that. You're kind of inhaling something that's just steamed, and it can't be that dangerous. But unfortunately, it is. So there are microfine particles that are inhaled when you inhale a vape pen, or you're inhaling it through that cartridge. You can have, so other than the nicotine, there are other microfine chemicals that are just in the heated product that you are inhaling. So things like nickel, lead, tin, formaldehyde, propylene glycol, which is actually a preservative that they use in the flavorings of the vape. So even menthol and those types of flavorings have glycerine and propylene glycol in them. And you're inhaling those into the lung. And now we have to remember the anatomy of the lung is made up of very many small, like tubes that kind of get smaller and smaller and smaller. And they go ultimately into like a bubble-like structure called the alveoli. And that's where your gas exchange takes place. That's where when you inhale, the oxygen gets taken into the bloodstream and carbon dioxide leaves from the bloodstream. And when you exhale, you're exhaling carbon dioxide. When you inhale a vape, and you inhale all these products that are listed here, it can get trapped into the small alveoli, and it can make it stiffer. It can make it more difficult for air exchange to take place. It can make it more difficult for you to exhale or do the carbon dioxide oxygen air exchange. And so this can lead to things like asthma, COPD, popcorn lung, which is popcorn lung is the specific stiffening of the alveoli. And it can lead to problems in aeration. And this can make it worse if you were to get infected with coronavirus or COVID-19. So there are initial studies that are kind of looking at how vaping and COVID-19 can be made worse also. So, but this is one of the main reasons why we don't want children to vape nicotine, and even THC for that matter. But essentially, many studies have been done showing that we know that adolescents are, one of my favorite age ranges to treat actually in the office, and that's because their brain is still developing. So they have a lot of out-of-the-box thinking. The adolescents are usually kind of, you know, they're risk takers. They like to do things, or they don't understand that certain things can be dangerous for them. They're kind of, you know, their full front part of their brain is not developed yet, so they don't kind of realize that they might be doing something that might harm them. They don't feel like anything can really harm them. But in that sense, their brain is still developing. And so when you expose nicotine to young brains or young adolescent brain, it does change their brain development. So, so an adult vaping who's over 25 versus a child who's like 15 or 14, which is sometimes the average age that a child may be exposed to vaping, it can change the way their brain is developed. It can change how, it can change like the milieu or the environment of your nerves in your brain. And if you expose nicotine at a young age, it can make you feel like you always need some type of stimulant or some type of you need that kind of product in your brain all the time. Like, it can change the pathways of your brain. It can lead to impulsivity, addiction, mood changes, anxiety. So I mean, and mainly addiction, which is really like you feel like you need it more and more. And if some children try to vape the nicotine early enough, they can get very addicted, much more so than an adult would. And children who vape are much more likely to become smokers in the end. And that's the whole reasoning behind vaping, was to limit smoking. And what we're seeing is more teens smoking and vaping, or from vaping leading to smoking. So I wanted to talk about a little bit about Juul, which is one of the brands of the vape flavorings, and they came up with a big campaign targeting children, which they later stated that they weren't trying to do that, but it was clear that some of their marketing was meant to target children. And the way they marketed some of their flavorings, gummy bear and bubble gum and a caramel, apple, some of the flavorings that they would offer mimicked some popular flavorings that children like. So because of this, there became, in many states, and there are many groups that are trying to sue companies like Juul for targeting the children, because that's what they did essentially. So nicotine does, there's a huge variance in the amount of nicotine that's found in the vape products. So if you kind of go to any vape shop, which there's still many down Jericho Turnpike or anywhere where you may be driving, you can totally find many shops that sell vape products. And they're not supposed to be selling to our children, but sometimes that's how the kids are getting it. So the nicotine content in them can vary, and sometimes it's not, so it still has not been regulated to the point where what it's identified as or how much the nicotine content is in the product is clear. So in some of the studies that were done, some children that vape don't even realize that there may be nicotine in the vape pen, or they may be vaping nicotine, that they feel that there is nothing in it, that it's nicotine free. But just because it may say that, it doesn't mean that that's the case. There's also vape, or you know, they need to have their next hit or fix. It's quite disturbing that children have to go through something like this, and their brain is changed. So I think one of the most important things that we need to do at this point is to try to impart the or try to delay the initiation, or delay children being exposed to it. So delay the starting point. If we can do that, if we can delay it till after 18, or at least after 21, the likelihood of them getting addicted to it in such a way where they're going to have a lifelong problem with it will be decreased. And then just to talk about the vaping-related severe lung illness. So this was back 2019. And there are still cases that have come up even since COVID, related to COVID, but essentially it's the vaping-related lung illness. And there's still lots of studies going on regarding the specific causes. They do feel that it was from post-marketed changes, so not the initial way it was marketed, but perhaps an additive that was added to it, and that was in the oil family. So the vitamin E acetate is the type of oily substance that the THC and in some cases nicotine was the actual packaging was changed, and then the children who inhaled those substances via vape, it injured their lungs. So it caused like a inflammatory reaction, and basically could cause severe lung illness where they would have difficulty breathing to the point of hospitalization. They would need a ventilator, and in some cases they needed an entire lung transplant. There was one incidence, one case that they needed a lung transplant, and they had to be on a breathing machine so that they could do that. The symptoms of EVALI, similar to I guess symptoms of any type of respiratory illness, so difficulty breathing, shortness of breath, fever. So because it would mimic an infection, so it would mimic an inflammatory response. Your body would make an inflammatory response, and that's why you would develop fever and persistent cough. And this would need to be evaluated urgently. You would want to go to the hospital or call your doctor urgently for something like this. And then this is also talking about EVALI, and this was the diagnostic criteria that we would use to make sure that that's what we were dealing with. And again, a CAT scan sometimes would be necessary to rule it out. And the reason why we're having difficulties now with trying to diagnose EVALI with COVID-19 illness is that you have to have the absence of a lung infection or other medical diagnosis to diagnose EVALI. But so they're still trying to tease apart some of the initial when we would see the severe COVID-19 lung illness. In March and April, it was difficult to determine whether if the patient was vaping or not, whether that had an association, because we couldn't diagnose that part of it if they were diagnosed with COVID-19. So that's still something that needs to be looked at more. We are seeing some increased, I guess you're maybe more prone to more severe type of COVID-19 if you've had a history of vaping. Luckily, we are not seeing as severe lung injuries in children that suffer or that are exposed to COVID-19. So we're still teasing out all that information, but it's still important to keep your lungs healthy. That's really, really important, and you don't want to start to vape. And what can we really do? Again, I think that we can't stop talking about it. We have to continue to talk about it. I know that we have a lot of other things on our minds right now, and that the information that we see on a day-to-day basis no longer includes the teen vaping epidemic any longer, but let me tell you, it's still a problem. I talk about it in every single adolescent well visit. And children are still saying that yes, everybody still does it. It's very easily accessible. The teens are doing it. Some of the teens tell me it's hard to say no because it's just so prevalent. It's just that, you know, it's not that it's hard to say no in terms of, you know, because it's just so common that it's hard to say, oh, no, thanks, I don't want it. It's more, okay, I'll try it and let's see how it goes, because it's so readily available still. But what can we do? So one of the things that I like to see, I talk about it a lot, and I talk about it with my own children, and it's tough. And you know, some of them have tried it. And I think it's kind of like our generations. I mean, when we were younger, smoking was big. It was like everybody was smoking. It was kind of like the done thing, and everybody was doing it, and it was kind of considered normal. And I think that's what's going on with vaping in our children. And it's kind of considered, oh, it's normal, it's okay. I don't know why you're making a big deal out of it, but it is. It's changing their brains. It's changing who they are. It's changing their mood. And you know, we need to work together to try to help avoid starting it. And once they do start, if they're having trouble with it, we need to help them. We need to help them quit. We need to help them find help. We need to help them. We need to help them to help themselves. We also may need to find other ways rather than punishment. Let's say in the school system, if they suffer from it or if they're caught with it, they do need to be kind of, I guess, you know, whatever the school's code of conduct is, they need to follow that. But maybe there should be some more rehabilitation or some referral to areas that can help them to quit, or a resource group, like a group of kids, of children that, you know, may be vaping. Maybe they all can do something together to try to help them out of it, because we're going to need help from the kids to help decrease the epidemic. And we want to try to encourage conversation about it. We want to try to talk about it. We want to say, like, why do you think you need to do that? Or why do you think you need to try it? And if you've tried it and you think you're addicted to it, then we need to help them and make it open, easy for them to discuss it with their parents or with their teachers or with their doctors. So I have changed actually my way of actually interviewing the kids or talking about it to the kids. I try to not ask, oh, are you vaping? Or, you know, you haven't tried vaping, right? Or I try to say, okay, if you've been offered a vape, or if you vape, I can help you stop. So now I sometimes start that conversation in my office. Like, if you've vaped or if you think you're addicted, I can help you and I can give you resources. And then they talk to me. So, so this is also, there are many, many resources available for this. You can reach out to your doctor, you can reach out to your pediatrician if you have found devices or something in your child's backpack or in their room. First, have a conversation with them, and then reach out to your pediatrician. We do have lots of resources available. There's lots of resources available, especially now, because we do want to make sure that the children are being helped. There was a big program by the Truth Initiative, which is basically a texting, an app, or actually it was like a, you text and then they give you feedback, they give you numbers that you can call to help you, or to help your child. It's for one, I mean, there are resources available for the parent and resources available for the child. It does take time. Because some of them can be quite addicted, and you need their full cooperation to help them to get through it. There's also the CDC has a lot of information available. I've found 2 programs in Huntington. So LICAD is the Long Island Council for Drug and Alcohol Addiction, and then there's also the Huntington there's also a Huntington alcohol and drug dependency program, and they are great. They have a lot of resources available. They have a phone number that you can call. They have a website. So there are lots and lots of resources for parents and children. And they come to schools. They come to, they can speak to you one-on-one, or they could do group sessions. So there really are a lot of resources available. This is from last year, so this is from before our current pandemic that we're dealing with. But basically, even the Surgeon General was quite concerned, and it is something that we all get affected by. And then there was a lot of legislative action. There still is. We're still trying to ban the flavors. We still have menthol available, so we're trying to get rid of that flavor as well. There is a big pro-vape, I guess, community. and again, this is not against adults that vape. If this has helped you to quit smoking, then maybe work on quitting vaping too, because we still don't have enough data available regarding smoking versus vaping. But children should not be vaping. So whatever we can do to limit the, I guess, draw for children, we need to do. We need to reduce advertising for it. We need to reduce the flavors. We need to make sure that the vape shops that are selling to underage kids are held accountable. We really need to all work together on this. And it's still something that we are seeing. I can't say that enough. So we may not be hearing about it as much. It may not be in the news as much, but it is happening, and the children are still vaping. This is just a slide I found recently. I wanted to, I mean, there's not that much information out there regarding specific COVID-19 and vaping. But again, if you kind of look at this and see how COVID-19 kind of gets into your lungs, and that's where it replicates, and that's where you can get sick, you can see that the chemicals from vaping can also similarly inflame your lungs, and that can ultimately make it more difficult for you to clear perhaps the virus. COVID-19 virus from your lungs too. So you want to have intact like membranes, intact mucous membranes, and you want to make sure that your lungs can clear any viruses or chemicals that are in your lungs. So if your lungs are unable to, it will make it more difficult for more easy, I guess, for your lungs to get infected or get inflamed. So it's kind of like a double hit there. And I think that about completes my portion of the presentation. I think if there are any questions, I'd be happy to answer them. I can't really see the Facebook screen, but yeah.
Dr. Siddiqui, can you hear me?
Yes, I can hear you.
Okay, so I can read you. There's just 2 comments actually on Facebook.
Great.
One person said, "So important at the high school I work. It is a huge problem. Thanks for educating people about this."
Oh, thank you. You're welcome. Really, I almost felt like I was doing this presentation and we don't really hear about it as much, but it is there. So I think now that schools are open and we're in session, even though we're masking and we're separating and we're distanced, it's still something that is happening. So yeah, I appreciate that. And thank you for saying that.
And then the other one is just another thank you. Thank you for doing this. It is an education for both our youth and us as parents. Lots of misinformation out there.
Yes, I mean, again, there is a large population of people that really like vaping, I guess, and the adults that are using it to quit smoking, I mean, yes, I still, like I said, I don't know the exact, if there is a benefit to vaping from smoking. I mean, perhaps there is, but the studies are still out on that. But it's really important that we prevent our kids from starting to vape. I can't stress that enough, because I think that we're going to have a generation of kids that are addicted to nicotine, among other things. So it is really important to try to stop that. And I think we can if we work together. So I appreciate that.
So that's everything we have right now. I want to just stress that if you have any questions, you can ask them on the chat. And of course, I will forward them to Dr. Siddiqui as usual.
Yes.
And I guess, let's see.
Yeah, that's great.
Oh, someone just said, "Great job, thank you."
Okay, great. So I'm glad that people are watching. You know, when we do these things, I feel like it's almost, I'm just talking in my dining room here, and I'm by myself. So usually it's not the way that I'm used to doing my presentations. I've had some before in the library in person, so hopefully we'll get back to doing stuff like that soon. But for now, I guess we kind of have to do it this way. But yes, please send in your questions. I'm happy to answer them. And again, if you have any topics that you want me to cover, I try to do this once a month. I think we do have topics out until like January, I think, or February even. But if there's anything that you guys want me to discuss or talk about, I'm happy to do it. And I'm happy to answer any questions that you have.
Thank you very much. I guess we'll end it there. Like I said before, if you put questions in, I will forward them to Dr. Siddiqui for you. And then,
great.
Okay, have a good night then.
All right. Thank you. Yeah, thanks, Eric. Good seeing you.
Let's see, I'll stop. We're gonna